If you've recently been diagnosed with gestational diabetes, you may have some questions. This short video, brought to you by the Marion County Public Health Department Nutrition Services, will help you understand the basics of what to do if you've been diagnosed with gestational diabetes. To get started, let's talk about what gestational diabetes is. It's a type of diabetes that only happens during pregnancy. It means that a pregnant woman's blood sugar level gets too high because their body isn't using insulin well. Gestational diabetes is not fully understood, but some of the risk factors include genetics, having obesity, having polycystic ovarian syndrome, and having a pregnancy over the age of 35. Insulin is the hormone that helps our body use sugar from the food we eat for energy. Sometimes, during pregnancy, hormones can make insulin not work as well. So that insulin can't take the sugar that's in our blood and put it into the cells where it needs to go for energy. If the body can't keep up, the sugar builds up in the bloodstream, and that's what causes gestational diabetes. It usually goes away after the baby is born, but it needs to be managed during pregnancy to keep both mom and baby healthy. After you have your baby, you will want to have your doctor double check that your blood sugars have returned to normal values. Having gestational diabetes does increase your risk for developing type 2 diabetes later in life. So it's important to monitor your blood sugar levels. Typically, pregnant women are tested for gestational diabetes between 24 to 28 weeks using what's called an oral glucose tolerance test. Glucose is another word for sugar. For this test, you're going to drink a drink that has about 75 grams of sugar. And then your blood sugar will be checked to see how well your body was able to get the sugar from your blood and into the cells of your body where it can be used for energy. If you haven't eaten anything, and that's called fasting, your blood sugar level should be less than 92. Higher than that typically means you may have gestational diabetes. If your sugar level after an hour of eating that 75 grams of sugar is higher than 180, or 2 hours after eating is higher than 153, that indicates gestational diabetes. So, how can you manage gestational diabetes? Number one, you got to understand what foods affect your blood sugar. So, we're going to go through that today. We're going to talk about how timing your meals and snacks out throughout the day can help keep your blood sugar steady. We're going to talk about the diabetes plate method, which shows you how to balance your meals and snacks to keep your blood sugar steady throughout the day. And then lastly, managing your weight during pregnancy. And if your doctor has told you to, monitoring your blood sugar is helpful to manage your gestational diabetes. We get energy from carbohydrates, proteins, and fat in our foods. And some foods are a combination of carbohydrates, proteins, and fats. And it's important that we eat from each of these categories. They all provide important nutrients for your body and your growing baby. Protein foods are foods like meat, fish, eggs, nuts and seeds, dairy, soy, cheese, and tofu. And fats are often found in protein foods, especially high-fat meats, and other foods like oils, butter, dressings, avocados, and other high-fat foods like cream or cheese and sour cream and fried foods, and baked goods often have lots of butter or fat baked into them. Carbohydrate foods are the foods that affect blood sugar the most. When carbohydrate foods are broken down in the body, they get converted into sugar in our blood. Fats and protein are used for energy, but don't necessarily cause our blood sugar to go up in the same way that carbohydrates do. This does not mean that carbohydrate foods are bad, but it means that we need to pay close attention to them and be careful about the timing, the types, and the amounts of carbohydrates that you eat. And that's what we're going to be talking about in this presentation. How can we do that? Let's talk through an example of what this can look like in your body and how you can regulate your blood sugar. So say, for example, you just ate some pizza. Pizza is made up of carbohydrates, protein, and fat. So the protein and fat are in the cheese and pepperoni, and the carbohydrates are in the dough of the pizza. And so when your body breaks that down, those carbohydrates, your blood sugar is going to rise. And when your blood sugar rises, your pancreas, which sits near your stomach, is going to notice that rise. It detects, oh, the blood sugar has went up. I need to do something about that. The pancreas then releases some insulin into the bloodstream. And that insulin is supposed to take that sugar from the carbohydrates and put it where it needs to be used. So insulin, you can think of insulin as the key that allows the sugar in the blood to leave the blood and go into the cells. You can think of it as a way of it unlocks the cells to allow the sugar to leave the blood and go into the cells where they should be going. Your cells then can use the sugar for energy or they can store it for later. And because the sugar has left your bloodstream, your blood sugar then will go back down. So this is how it's supposed to work when you have gestational diabetes. Your pregnancy hormones are interfering with this process and it's not working as well. So the key, the insulin there, is not going in that lock anymore. It's not opening those doors so that the sugar can go from the bloodstream into the cells as well. And so that process is not as efficient. And that's what happens when you have gestational diabetes. So we're going to talk about ways we can manage that. Here are some carbohydrate containing foods. So grains contain carbohydrates, pasta, bread, rice, anything made with flour or wheat, oats, and cereal have carbohydrates. And then starchy vegetables have carbohydrates like potatoes, winter squash, beans, peas, and corn. Grains and starchy vegetables are a great example of complex carbohydrates. This type of carbohydrates are digested pretty slow, and they provide us with energy that causes a slow and steady rise in blood sugar and a slow and steady fall, as opposed to a big spike in your blood sugar and a big fall in your blood sugar. Complex carbohydrates are things like whole grains, pasta, bread, rice, other grains like farro or quinoa, oats, and then those starchy vegetables, beans, lentils, potatoes, sweet potatoes, and winter squash. So here are some other forms of carbohydrates. We get carbohydrates from fruit and fruit juices, milk and dairy, and foods that have added sugars like sweets, sodas, and sugary beverages like lemonade or sweet tea or sugary coffee beverages. These foods are more simple carbohydrates. They get broken down pretty quickly in your blood, and your blood sugar can spike quickly and fall quickly, which is something we want to avoid. These foods are not all created equal. So, compared to many of the other foods, we know that fruit has important vitamins, minerals, and fiber. And then milk and dairy have important nutrients like protein and calcium and other important minerals. So we just need to be aware that while we still need those foods, we need to be aware of how much we're having, what we're pairing them with, and not eat too much at one time. The other foods in the image are high in calories, and they really don't have a whole lot of other nutrients for us. So those should be limited. I should say as well that fruit juice contains some good vitamins and minerals, but it's been stripped of the fiber. So it's okay to have a small amount of juice if needed, but it's always better to eat a whole piece of fruit instead of fruit juice. And so if you're going to have juice, try to limit that to no more than probably about 6 ounces, and make sure you pair that with other foods that aren't high in carbohydrates. When you have diabetes, it's most important that you focus on limiting added sugars. Added sugars are foods that are not naturally there, they're added to our foods, and these cause a big spike in our blood sugar. So limit those sugars as much as possible. Those are in foods like sodas, sugary cereals, candy, cookies, cakes, other sweets types of things. And so aim for less than about 25 grams of added sugar per day. So that's on the food label highlighted. That's about 6 teaspoons of sugar per day. So you want to try to limit foods that contain added sugars. The goal with gestational diabetes is to keep your blood sugar nice and steady throughout the day. It's going to fall and rise throughout the day depending on when you eat. And in the graph, you can see the green level in the middle showing your blood sugar levels that rise slowly after a meal and then fall in between meals, and that's normal. However, we want to avoid big spikes and big dips in your blood sugar that you can see in the reddish orange line where the blood sugar goes too high and then quickly falls a little too low. And you don't feel very good when your sugar is on that big roller coaster of blood sugar. You'll feel a lot better if you can keep your blood sugar more steady. So to do that, we need to think about the carbohydrate foods and how they're getting converted to sugar in your blood and how your body's going to manage those. So pay attention to the timing of your meals. You really want to get into the habit of having a regular meal schedule where you're eating breakfast, lunch, and dinner, and some snacks in between if needed to spread carbohydrates out throughout your day. You don't want to wake up and not have any carbohydrates for breakfast and then not have any for lunch and then have a big plate of spaghetti with breadsticks with a lemonade with your drink in the evening. That's going to cause your blood sugar to have a huge spike in the evening right before bed. So we want to spread those carbohydrates out throughout the day. We want to think about the type of carbohydrates you choose. It's best to choose more of those complex carbohydrates, the pasta, the rice, the starchy vegetables. Those are carbohydrates that take your body some time to break down as opposed to having mostly simple carbohydrates like fruits and sweets. We're going to talk about amounts of carbohydrates on the following slides. And then the other thing to think about is how to kind of combine your foods. Combining carbohydrates with your proteins and fats and creating a balanced plate can help the carbohydrates slow down in the way that they're converted to sugar. So protein and fat and fiber help slow down how quickly carbohydrates get turned into sugar in your bloodstream. Using the diabetes plate method can help you visualize how to build a balanced meal that helps you maintain a healthy blood sugar level. So to do this, what you want to work on is filling half of your plate with non-starchy vegetables. We'll talk more about non-starchy vegetables in the next slide, but they have very small amounts of carbohydrates and they have a lot of fiber. They really don't affect your blood sugar very much. They can help you stay full, and typically the fiber helps slow down how quickly other carbohydrates in your meal get converted to sugar. You want to make 1/4 of your plate filled with lean protein source, and then the other 1/4 of your plate filled with your complex carbohydrate, your whole grain or starchy vegetable. Pay careful attention to the timing amounts of fruits, carbohydrates, and starchy vegetables as we've talked about. And remember, proteins and fats don't affect our blood sugar, so eat more of those if you are still hungry. Here's another example of what that plate method can look like using real foods. We want to aim for a variety of colors and food groups when making a plate of food. And here's that list of non-starchy vegetables on the left. These are foods that have that fiber and they really don't have the carbohydrates. They have a very small amount, but not enough to affect your blood sugar very much. And then our carbohydrates, we see the sweet potato in this meal, a good source of complex carbohydrate there, and then a good source of protein in the other quarter of our plate. So this is what that can look like. One thing you may have heard is that it's helpful to eat small, more frequent meals to keep your blood sugar level balanced. And this can help because you're not overwhelming your body with too many carbohydrates to deal with at one time. Think of it as you're going a little easy on your pancreas so that the insulin has time to get deal with those carbohydrates. It's working really hard and you don't want to overwhelm the insulin in your pancreas to work so hard to deal with too much sugar at one time in your blood. So, three smaller meals and maybe 1 to 3 snacks in between meals is a good way to help basically not overwhelm your body with too much sugar at one time. And then in the morning time, cortisol is your body's main stress hormone. It's naturally a little higher in the morning when you wake up, and it can cause your blood sugar to go up in the morning despite what you have eaten or are eating. So it's really important to eat a breakfast that prioritizes protein and is low in sugar and kind of on the lower side of carbohydrates, especially if you've checked your blood sugar and it's too high. So protein also helps your body kind of slow down that overwhelm of sugar that can come from carbohydrate foods if they're eaten without a good source of protein. Protein also helps you feel full and satisfied, and you're less likely to have cravings for sweets and sugar. So here are some examples of healthy, balanced breakfast choices, including eggs, really high nutrients from eggs that your body needs during pregnancy, and some protein in there, and a little bit of fat. However you like them is fine. Oatmeal is a carbohydrate, but it's got lots of fiber in there. And if you pair it with some high protein Greek yogurt, maybe some nuts and seeds, that's a great breakfast. Another example here is we got some whole grain toast with some avocado and some eggs on top. So those are some examples of kind of spreading your meals out and what a healthy low sugar breakfast can look like. It's really important that you eat plenty of fruits and vegetables throughout your pregnancy. They have lots of vitamins and minerals and fiber that your body needs and your baby needs. Here are some things to keep in mind. You can use fresh fruits and vegetables, frozen fruits and vegetables, or canned, but you want to try to find them without a whole lot of sugar and salt added to them. We already talked about this, but really important to choose whole fruit instead of fruit juice when possible. When buying canned fruits, look for labels that say no added sugar. So look for cans that have that instead of heavy syrups or even light syrups. We really don't need to be adding syrups to our fruit because they are already a carbohydrate. So we don't want to add added sugar. When buying canned vegetables, look for vegetables that have no salt added as a way to decrease your sodium intake. So fruits and vegetables can be had in many, many forms, and they're very important for your pregnancy. It's really important to prioritize protein during your pregnancy. Protein helps you feel full and satisfied. If you're not eating enough protein, it can make you hungry during your next meal. It could make you maybe eat a little too many of the carbohydrates that you're trying to limit. So when you choose your protein foods, look for lean protein sources. For example, grilled chicken breast over fried chicken breast or other fattier cuts of chicken like thighs. If you buy ground beef, try to look for at least 85% lean ground beef or higher. Fish is a great source of lean protein. It's got some of those heart healthy fats that are important for your baby's brain development. You want to look for low mercury fish such as salmon or tilapia or cod, and try to eat fish twice a week. If you don't enjoy fish, There are lots of other plant-based protein options like tofu, seeds, and nut butters. It's important you avoid processed meats while you're pregnant, so stay away from salami, deli meat, hot dogs, and bologna. It's important to talk about artificial sweeteners or diet sugar-free products. And so remember, we have that recommendation to limit added sugars to no more than 25 grams per day, which is about 6 teaspoons. So when possible, the best thing to do is to choose unsweetened beverages like water or carbonated water. Or if you are going to drink soda, diet options or zero added sugar options are better options than regular soda. The more harmful thing is to get that sometimes up to 10, 11 teaspoons of sugar in one can of soda can really spike your blood sugar really high. However, you do want to avoid artificial sweeteners that are the Sweet and Low. It's made out of saccharin, and we do know that saccharin can cross the placenta and remain in fetal tissue. And so that's not the best artificial sweetener to use during pregnancy. The best thing to do is to limit added sugars, but if you are going to have a sweet like a soda, go ahead and choose diet that's not artificially sweetened with saccharin. Lastly, we know that gaining too much weight too quickly during your pregnancy can increase your risk for other health issues throughout your pregnancy. So you want to monitor your weight, discuss an appropriate amount of weight gain with your doctor and dietitian, and try to stay active during your pregnancy. Movement can help your body move sugar from your blood into the cells. And so when you move your muscles, they help pull sugar out of your bloodstream and into the muscle tissue. So discuss with your doctor what exercises are safe during your pregnancy and try to stay active. Limit those foods that have lots of calories but not a whole lot of nutrients like sweets and sodas. These can increase weight gain without getting the benefit of the nutrients that you need. If your doctor has asked you to check your blood sugar, you can use your glucometer to check your blood sugar and record your findings. And then you want to report those findings back to your doctor or your dietitian so that they know how things are going for you. And you can use this data to kind of help understand what and how foods affect your blood sugar. And then your doctor will decide if any other treatments are necessary to help manage your blood sugar. If your doctor has told you to check your blood sugar levels, these are the numbers, the recommended ranges that you want to try and aim for. So first thing in the morning before you have anything to eat when you are fasting, the number that you get, it should be below 95. And then 1 hour after eating, your sugar should be below 140. And then 2 hours after eating, you're aiming for your blood sugar to be less than 120. And then another test that may be used to gauge what your blood sugar is doing is called an A1C test. And this is a 3-month average of your blood sugar. And the goal with that is to keep it below 6%. So it's important to manage gestational diabetes to take care of yourself and your baby. Gestational diabetes increases the risk of macrosomia, which is basically large birth weight, and this can make for a painful, difficult delivery and also can cause birth injuries. Your baby also has a higher risk for being born with hypoglycemia, which is low blood sugar when they're born, and this can also cause some breathing problems. There's also an increased risk for obesity and type 2 diabetes later in life for your baby. For the mother, gestational diabetes can cause hypertension or high blood pressure. This increases the risk for preeclampsia, which can limit the blood supply to the placenta. It also increases the potential for a C-section to be necessary. This also, we know that women who have gestational diabetes are at increased risk for type 2 diabetes and heart disease later in life. There's a risk for gestational diabetes in subsequent pregnancies as well. So if you have gestational diabetes in one pregnancy and then you have it again, if you have another child later, there's a good chance you may have gestational diabetes then too. So you want to be on top of that and make sure you're getting it checked. For most women, blood sugar levels will return to normal after you have your baby, but it's a good idea to continue to monitor your blood sugar and continue the healthy lifestyle habits that you have established. And this is really important for trying to prevent or delay the development of type 2 diabetes. Continue to be careful of how much added sugar you have and eat balanced meals as much as possible. It's a good idea to continue to try and follow the plate method, as that's a really healthy general way to eat, even if you don't have diabetes. It's a good idea to introduce exercise back into your routine after being cleared by your doctor and focus on those whole foods and lots of fruits and vegetables. Also, consider breastfeeding. We know that breastfeeding can help a little bit with postpartum weight loss, and it can also help our bodies use insulin better again. Make sure you follow up with your doctor about 6 months postpartum to check in, make sure your blood sugar levels have returned to normal. Lastly, congratulations on your pregnancy. We hope that this information has helped to clarify any questions you may have had. If you need additional help, we have registered dietitians that are available to answer your questions, and you can call the number on the image. Our team of dietitians is also, most of them are lactation specialists as well. So if you have breastfeeding questions and concerns, you can reach out to that number as well. Best of luck during the rest of your pregnancy and on this new journey.